Hello everyone, I'm Subrat Bahinipati and thank you today for joining with me because I'm getting so many questions about chronic pain and fibromyalgia, and probably you are watching this in the same group, or maybe you are watching in YouTube. Does not really matter because I think it is extremely important now. I need to clear that up. Uh, so what is fibromyalgia? Or because that is a question people they ask. And this is no little thing. Over the years, I have seen thousands of women suffering with, that's how they give the name fibromyalgia, or they can become as a chronic pain, or they call as a chronic fatigue syndrome. So these are all different names. And that is extremely, extremely confusing. So this is something I want to. So in my previous video, I was talking like how our medical system over the years, hundreds of years, people who are dying because of infection. So then we started treating everything like infection. So if you have a problem, so we will test like if you have any kind of infection or anything like that. That's how you be given medication to get treated. And that worked out pretty well for the infection. Like, for example, this is what we talk about diagnosis, and we get stuck in diagnosis. So let's see, let's take one simple one, like pneumonia. So pneumonia, of course, you have symptoms. Your physician suspect you of pneumonia, and they test it, take an X-ray or do a blood test, and find the bacteria, pneumococcal bacteria, then give you the antibiotic to kill it, and you feel better. So that is the value of diagnosis. And then we have to know what is going on. Then we use the tools. Tools are the normal tool, like your imaging tools, X-ray, MRI, or your CAT scan. Or another tool is your blood test, or other kind of test which is derived from your blood or saliva and other thing. So not this is where the problem happened with fibromyalgia. In fact, when I was going to school, that was many, many years back, almost like 30 years back, I never heard of that word, fibromyalgia. Well, I know people have chronic pain, and anybody can suffer with chronic pain. So for today's discussion, let's put everything together. Forget the name, fibromyalgia, chronic pain, this, that. We forget everything, and we put them all in the same umbrella. And let's call that as a chronic pain. Now, when they come up with fibromyalgia name, that time, what really happened, they said, well, I cannot see this. That should be an issue in the blood. So blood test is coming out to be normal, but standardized blood test, I mean. So standardized blood state, whatever that is, they're coming out to be normal. Then there is no X-ray, MRI finding. If it is finding, it is not very inconclusive. So what it could be? So that time they thought it probably is something like an autoimmune disease. Now, what is autoimmune disease? I can give you one great example. It is rheumatoid arthritis is an autoimmune disease. Autoimmune disease is where your body attacks itself, thinking that it is not himself, is a foreign body. It attacks. That's what happened in rheumatoid arthritis. So they give this charge to rheumatologists because they are the one who treats autoimmune disease like rheumatoid arthritis. So basically what they do, diagnosing autoimmune disease, they take a blood test, and that should be a factor in the blood test. Like for example, rheumatoid arthritis, they have this factor of rheumatoid factors, and then they check for tenderness. So that is the only way they can detect any kind of autoimmune disease, and that is a convenient method for them. So when they thought the fibromyalgia, is kind of autoimmune disease, they fit into their formula. They look for the blood test, but actually they cannot find a fibromyalgia factor or something like that. They couldn't find anything like that. But they stuck up with the tender point. So they have blood tests and the tender point. Now they no blood test, so they're stuck with tender point. So whenever they cannot find anything and they press few places, if the tender points come out to be diagnosis. So they come up with the diagnosis of fibromyalgia. It is based on only in a tender point. And that is absolutely crazy. Now we know there's a lot of research has been done for this. So what do we know? There is nothing so-called diagnosis like that. So this is a process of elimination. So we see one thing, we don't know what that is. Like an animal, we don't know what that is. So we say, well, it's not flying, so this cannot be a bird. So this thing is not in water, cannot be fish or any kind of thing. I'm just giving you the example. So it is walking with 4 legs. So it has to be some kind of land animal. So this is how we started eliminating. So if we cannot find or fit into any of these things, then depending how you complain, that will be the label you are going to. So about all this chronic pain, fibromyalgia, and all this thing, what I personally say, yes, the symptoms are real, but the so-called diagnosis is absolutely bogus. That does nothing, because these people have given this name, but what been getting done, how that is helping them, how the process is working. So now we know whatever we know so far, this is not an autoimmune disease. So you cannot suppress the immunity like what we do is a disease modifying drug for rheumatoid arthritis. It is nothing like that. You cannot find anything in X-ray, MRI, or imaging. There's no blood test. But what we get focus on, whatever the patient is complaining. So if you complain of a lot of pain or widespread pain, then you'll be diagnosed as fibromyalgia because nothing else to be pinpointed on. But that is not helping you because pain is not only symptom. I'm going to get to that. So if you do not complain that much about pain, you complain of fatigue all the time, then you will be given the name of chronic fatigue syndrome. But it can change time to time. You might be complaining of fatigue. They'll say, oh, you have chronic fatigue syndrome. Then a few months down the road, you say, well, my fatigue is not too bad, or maybe it is there, but my pain is more. They will say, oh, you have fibromyalgia. This is what I see. It will be one after another. Okay. So myalgia is a term. Myo means muscle. Algia means there is inflammation. They was thought there's inflammation going on in the muscle. So that is kind of okay for that time. But it is, we know that is nothing like that. It is going on. So far, this is what we know. So these are nothing like that. It is just a group of symptoms. So you might have actually 5 symptoms, 10 symptoms, 20 symptoms, 30 symptoms. So this is just a group of symptoms. And you know, you cannot sleep. You feel tired all the time. You have pain. Sometimes you are hungry, sometimes you are not hungry. You don't feel like doing anything. You have incontinence issues. Pelvic muscles are getting really, really weak. So there is a lot of cascading things are going on, but this is just a group of symptoms. So it is not a true diagnosis, it's a group of symptoms. And the symptom is chronic pain. So I would like to touch base a little bit about pain itself, though I cannot elaborate too much on that. So people talk about this, like, you have acute pain or a chronic pain. Acute pain is like if you hurt yourself, you went, broke your arm, of course your pain is acute. So that is a research, not one, many research has been done. So if I take a pin, I prick on your hand or in your arm, anywhere in your skin, your brain is going to pick up, because you have a sensory area in your brain. Brain is going to pick up that why do I prick the pain. But that is what happened. We have a sensory area, we have a motor area. So if I stimulate the motor area, something in your hand, if I'm pricking wherever I'm stimulating, that area is going to move, because that's the motor area which is responsible for movement. In a sensory area, wherever I'm going to do, touch it, or I pin prick, is going to pick up. But when they look for somebody is complaining of chronic pain, the motor area or the sensory area. So what the heck is going on? So if somebody is complaining, either they're lying or they just don't know where to find it. And this is where the confusion begins. So according to the convenience, many of the physicians, they say, well, I cannot see it because these are the tools I have. So you know what? It does not exist, because that is a tendency. If I cannot see it, I'm not going to believe that really never really exists. So that's what they choose to believe. Yeah, women, they complain too much. They just have emotional issues. So they choose not to believe. And even if today there are many are there, they choose not to believe. And the other one, they say, well, we just have to give a name. So we give name whatever they're complaining. So it is very symptomatically. So this is how it got developed. But all this medication, what is developed, whatever you are complaining mostly of pain. So most of the medication, these are powerful medication, it has a tremendous amount of side effect. But only the medication is given to address only the pain. But as I told you, you have like other symptoms, actually a list of symptoms. So, and third thing, the chronic pain is somewhere we cannot even see. So to describe more in detail, we need to go to a different kind of territory. That is how we explain. I don't have time today to explain all that in this video, but I always do a webinar, and I'm putting together another webinar. It will be 2 hours long, just to explain that what actually is fibromyalgia is, and how that affects, and what it is, how it is. It basically, it is going to sum it up. That'll be a 2-hour webinar I'm going to do. I'm in the process of releasing the webinar. So keep in touch. You can always, instant messages, or you can call, so that when the webinar is coming up. But this is what I'm talking about. So the fibromyalgia itself is nothing more than a group of symptoms. And the symptoms are so much that it is kind of life-changing and devastating. And this is why I know many people, they feel like that they're disabled, and they actually apply for disability because of the symptoms. So if we have only pain and the tenderness is the only criteria, so then we have started applying the criteria across the board. First thing, you cannot find anything in the imaging or blood test. Second thing, they're tender. That's it. So that actually accounts for almost everyone. So when they cannot do that with female, and they started putting males, because I have seen some males, they've been diagnosed and sent it to me. But when we dig in deeper, they actually have other kind of issues or other kind of disease, which can be treatable. It is nothing like fibromyalgia. So basically, it is a condition, mostly, as far as I'm concerned, it affects women. And if you look at all the symptoms of fibromyalgia, and look at all the symptoms that happen when there is a hormonal imbalance is going on in the body. There are two major hormones, estrogen and progesterone, when they are not in balance. So when they're not in balance, so someone have a hysterectomy in the past, then it can create hormonal imbalance. Sometimes you might not have a hysterectomy. Uh, the hormones are messed up. So there are many reasons are there for that. I'm not going to go into detail, but anyway, the hormones are not balanced. So in absence of the hormone, as like hysterectomy, or a very early menopause, average menopause is 52 years in the United States. So then what are the symptoms it can happen? And all those symptoms do exist in fibromyalgia. So they can go hand by hand, and that has been a lot of research. It is done. So then they get to thinking, well, if we give hormone, then should feel better. In certain people, in certain condition, yes, it do help. But then hormone replacement therapy comes with a lot of taboo, because that is another story, another video, another day. Because people get scared because they thought, if you take hormone, it's going to cause cancer. Well, hormone does not cause cancer. We come out about that. But what it does, it can fuel if you already have cancer. So you have to be very careful when you are taking hormone replacement. But then the basic thing is that no matter what we call, it is a musculoskeletal disease. This is what I want to emphasize. So fibromyalgia is a group of symptoms. It is no name. I don't care what you call that. So the whole thing is a group of symptoms. And the symptoms affect your muscles and your skeletal system. And another system too, which is the connective tissue system. This is what I want to elaborate, but not today. So when all these systems are getting affected, it is producing symptom. So when the musculoskeletal system is involved, that is not the right tool, is not the medicine. Medicine cannot do anything about this. Yes, it can, in a high potency, it can reduce some of the inflammation, maybe temporarily some of the pain. And I know many people, the pain is so excruciating, they have to take narcotic pain medication. And again, narcotic pain medication, it actually kills almost like 60 people every single day because of overdose. It can create addiction in 3 days. So it has its own issues. But that is not the reason. So this is what I want you to understand for the time being. That fibromyalgia or chronic fatigue syndrome or anything like that, this is not a true diagnosis. Yes, it is a label. It is given to a group of symptoms. So if you are trying to cover up the symptom, so we will be right so far. And because you can imagine now, you can think you are in this group, so you should know how you are now. You are worse than last year. How you are last year, you are worse than 5 years back. It is a downward spiral, as there's a lot more going on. And it is not only to do with the physical, it has a lot to do with how we feel. The kind of stuff we have went through in our life, all this thing has a big factor, how the chronic pain actually developed. And one thing lead to another. Imagine yourself, when you are first time, you are all better. You have no diagnosis, no pain. Now you imagine what really happened after that, all the life event you go through. If we always stuck and think everything is kind of physical, because we cannot really separate body from mind. Whatever happened to us, like in our life, if we went through some kind of stressful situation, problem. And this is something it takes time to explain. I'm not going to explain it today. maybe some other day, but I'll do a webinar explaining all this thing, what it is, how it happened, how your mind affects, how the emotion, the kind of stuff you went through in your life. But this is good thing to think about today, rather than thinking, well, I have fibromyalgia, nothing can be done. I have few medicine, either I want to take it or I don't want to take it because it makes me feel certain way. But in the other hand, I have so many other things are happening. Many of you probably already went through surgery initially, maybe have a carpal tunnel surgery, then probably they tell you, oh, we need to have your probably have his shoulder surgery, have back surgery, and toward the end of the road they cannot find anything anymore to do. You run out of real estate, then put a label fibromyalgia and let you go. And this is why pretty much I'm treating this chronic pain condition almost like more than 20 years. We have treated thousands of people right here at Synergy Therapeutic Group, but we are looking at the wrong thing, doing the wrong thing, and we are hoping. So actually, I have a poster here I like to share with you. I don't know if you've never been to our clinic. I'm going to share with you if it will be visible. Yeah, I love this poster. It calls insanity poster. So insanity is actually doing the same thing over and over again and expecting a different result. So looking at the wrong thing, and we are trying to do, and this is what our mindset is. So nothing else is going to happen. So so what we are saying, we are using the standard tool, we are using the standard thing, but this group of symptom is not like that. So you guys can comment anything, or if you want to know more and what you really want to know, you can always put it in the comments. Okay, I try to get to it, try to explain it more and more and more. And again, we have a lot of webinar is going on now. I'm doing it. Even if you come to a back pain webinar, we talk a lot about the whole body itself, not only just the diagnosis, because diagnoses are just the label, and just treating a diagnosis like a chasing a pain, and you can go so far chasing any kind of pain. So unless you treat a whole human being, nothing is going to happen. So you can chase them, the diagnosis or whatever so far. But again, thank you so much for being with me today. And we are going to come up with something else next week. So good luck. You have a wonderful day. And also you have a wonderful week. Thank you so much.